Hi fertility friends, this is Dr. Daniel Skora from Fertility Specialists of Texas here on our Facebook Friday Live. Today we're going to be talking about egg freezing, one of my favorite subjects actually to talk about with my patients. And we have a bunch of questions that have been sent in from our patients as well as the top questions that are asked about egg freezing among online forums. We also will later talk with one of our employees who actually went through egg freezing to preserve her fertility in the past.
So the first question that was sent in is, what is the best age to freeze your eggs?
So there is no perfect age to freeze your eggs. Obviously, the earlier you freeze your eggs, the better, because we'll be able to A, get more eggs, B, the quality of those eggs will be better, and C, likely they will thaw better later on in life. So unfortunately, women are born with all the eggs that they're ever going to have in their lives, okay? And over the course of their reproductive life, about 42, 43 years, the machinery inside of those eggs stops working as well over that time period. What does that machinery do? That machinery, when it's time for fertilization, pulls apart the DNA inside of the eggs and puts it together with the DNA of the sperm, okay? And as women get older, especially after 38 years old, that machinery doesn't work as well. And that's why women later on in their reproductive lives end up having more miscarriages, because that machinery that's putting together the DNA makes more errors. And so with that, after the age of 38, that rate of miscarriage goes up and the rate of live birth goes down pretty precipitously or very quickly because of that machinery not working very well. So is there a perfect age? No, there's no perfect age. We will try to freeze as many eggs as we can no matter what age you come in. Before age 38 is definitely the best time to do it, because at that 38 cutoff is when things start not looking as good.
So a lot of people are asking, and I know that it's not everyone's favorite topic to talk about from the physician standpoint, but how much does this cost?
So that also is variable from clinic to clinic. Generally, I don't like to talk about money at all with my patients. I like to talk about what the reason we're doing this for and how we're going to make it happen for you. But in general, since we're only doing the first part of the IVF cycle, so when we normally do IVF, we do the first part where we get the eggs, we then fertilize the eggs and put the embryo back into the uterus. We're only doing that first half, so it is less than a normal IVF cycle. But it also depends on how much medication you'll need for the cycle as well, which is something that is individualized for every patient. My goal when I'm doing egg freezing for all my patients is to only have to do it once. So I push my patients pretty hard when it comes to the medications so that we get a lot of eggs that first time so you don't have to do it more than one time. But I would guess budgeting wise for most patients, if you think about a $10,000, if you have no fertility coverage, no coverage for this at all with your insurance, is about what most people expect to pay.
So is the process painful?
I would say the process is not, we're going to talk to someone who went through it right after this, but the process itself is not very painful in terms of the process of the IVF that we do at the beginning. You're taking the medications. Those are little injections under the skin that are generally like an insulin needle. So that's a pretty tiny needle that most people don't even feel. Most of my patients complain towards the end of the process that their ovaries are getting really big, and with that they feel pressure and pelvic fullness, and that's probably the most common complaint that I get. Excuse me. The actual retrieval itself, when we get the eggs out, when we harvest the eggs, the patient's asleep for. We do use a long needle through the vaginal wall into the ovary to suck out those eggs during that procedure. And so with that, most women will complain of a little bit of vaginal soreness for the next 24 hours. One rare complication nowadays is something called ovarian hyperstimulation syndrome, where, as I said before, we tend to try to get a lot of eggs out of people. And with that, your estrogen levels might get very high during this process. With that, you could have fluid shifts in your body, blood clots in your legs, all extremely rare, way, way less than 1% of the time. And nowadays, we have really good medications to prevent that from happening and from getting really bad. But those complications can happen, and they do happen, but they're very, very rare.
So one of the questions, and you kind of alluded to kind of swelling and things like that, is do you gain weight during the process?
So I would say yes, you probably will gain a couple of pounds in terms of water weight. I would say most women do that during the process, but generally by a couple of weeks after the process, that's all gone.
Okay. So can you get pregnant naturally after you do egg freezing?
Absolutely. So one of the misconceptions about egg freezing is you're draining all the eggs out of my ovaries. I'm never going to be able to get pregnant afterwards. That's just not the right way to think about this. So every month, a woman's ovaries produce a group of eggs, okay? And your brain tells your ovaries to make one of those eggs or follicles grow and ovulate. The rest of those follicles that were selected for that month that contain an egg, they all die off each month. So in reality, a woman is not losing one egg per month, they're losing in the 50s to hundreds of eggs per month, okay? And with that, what we're doing when we're egg freezing eggs is just making all of those eggs that were selected for that month all grow together so we can get them all together. It does not affect future fertility. It does not affect the next month you'll produce another group of eggs as well. It does not mean you'll go into menopause early, none of those things. Plenty of women go on to then get pregnant on their own. I will actually say, if you, there have been several New York Times articles about this process as of late, that a majority of women, after doing this, actually do go on to go and have a baby on their own without ever using their eggs. So in reality, what this process is for is to give you peace of mind, that you don't have to worry about when you start a relationship that my clock is ticking, that I have to jump to having kids right away, because you have this as an insurance policy, quote unquote, behind you, and you can live your life. And if you try to get pregnant and you don't, you still have these eggs in the bank ready to use in the future.
So talking about my future, how long can we keep eggs on ice?
Once the eggs are frozen, so only mature eggs will be frozen. Once all the mature eggs are frozen, they are good forever. Okay, so yeah, crazy to think of like becoming 60 years old and using your eggs, but generally women, they will stay forever. Now the question then becomes, are they still good? Yes, as soon as they're frozen, if we thaw them in 5 years, it'll be the same as if we thaw them in 10 years or in 20 years, okay? But the question really becomes is, will they work at that time period? So we talk about the number of eggs. I'm sure this is one of the questions we'll talk about later. How many eggs do we want to freeze? But when we freeze eggs versus embryos, there's a different quality. So an embryo is an egg that's been fertilized by a sperm, okay? Generally, we have about at Fertility Specialists of Texas, we have about a 95% survival rate for a thawed blastocyst, which is an embryo that's grown to the 5th day when we normally would transfer an embryo, okay? In terms of a frozen egg, our rates are somewhere in the range of 80 to 90% of thawing and survival. When you think about it, an oocyte or an egg is one cell, one big cell, okay? Versus an embryo, which is hundreds of cells on that day 5, okay? So that one big cell is much more likely to be damaged by a freezing process than all of those little smaller cells, right? So with that, that's kind of why we like to get a lot of eggs, because we want as many as we can.
What causes poor egg quality? Because you kind of mentioned eggs that survive or mature. So what's the difference? Like if I retrieve, how many would I retrieve, and then how many can actually be frozen?
So the egg quality is almost entirely related to the age at which you freeze them. So some women, even when they're 25, will have a very low egg reserve, and we don't necessarily don't know why. And some women, when they're 40, will have a ton of eggs, likely because they had polycystic ovarian syndrome. You have to look at other videos for that, which is a whole nother topic. So they will have a ton of eggs when they're 40. So it doesn't really relate to that, but inherently, the age of the woman is the most important factor when we're talking about a quality of an egg, okay, and a quality of the embryo. Because we don't really know the quality of that embryo until we fertilize the egg, let it grow, if it does grow, and then do a genetic sampling of the egg, right? So that's why we know 100% that a younger egg is much more likely to be a better quality egg.
And you may have kind of covered this, but how many eggs do you want to try to have frozen?
So the big answer is as many as possible, okay? There are patients who will go through multiple cycles to get as many eggs as they can. And, there have been studies that have been done. One major center in Washington, D.C. that does a lot of these egg freezing cycles show that women who are under 38 years old, we recommend freezing between 15 and 20 eggs. And generally, at least at that center, That 15 to 20 eggs will give them about a 75% chance of having at least one baby, one live birth, and also about a 50% chance of having 2 children from that same lot, and up to a 20% chance of having 3 children from that same lot of 15 to 20 eggs. Now, when we're talking about women who are over the age of 38, we like at least 25 to 30 mature eggs, and that gives them about a 65 to 75% chance of at least one live birth.
And that kind of leads me into our last question before we bring in Bonnie is, what is the average pregnancy success rate using frozen eggs?
So something that is important to know is that this process is a newer process. So we've been freezing eggs and embryos for a long time, but only recently, in the last 5 to 10 years, the technology has really improved. So what we used to do is we used to freeze over a slow process embryos and eggs. And when we did that, crystals would form inside of the eggs because, as I said before, there's only one big cell. So an ice crystal would form in the egg and make the egg pretty much explode. So we were really not very good at this back in the day. Now with the new vitrification process, which is when we flash freeze the eggs using liquid nitrogen, that doesn't happen. And we're much better at thawing those eggs and using them. But since this is a newer technology, I can't give you exact numbers of how many of the pregnancy rates related to it. So yes, this is an emerging technology, and I always, when my patients come and talk to me, I always talk to them about the fact that this is emerging. There's no guarantee of having a baby from this, but it's doing something to hopefully preserve your fertility.
Perfect. So we're going to hand the mic over to Bonnie so that she can kind of talk about her first person experience.
All right, here's Hi. Bonnie. So Bonnie works with us in our billing department, and she underwent an egg freezing process. How long, Bonnie?
October 2019.
So not very long ago at all. So tell us about how the process went.
I mean, it went fine. I had to meet with the doctor first, and she kind of went over everything that was going to happen and what we were going to do. And then I would have sonograms every couple of days. In the beginning, I was just taking one shot and like a birth control pill. And then once I got into the stem meds, I was taking 3 shots a day. Usually it was like 2 in the evening and 1 in the morning. But I mean, I don't know. I didn't have any like adverse reaction to it or anything. And I was really excited with the outcome.
So one of the questions that I get asked a lot is, how long does this process take? And my goal for all my egg freezing patients is to make this process as easy as possible for you, okay? So generally it takes a month, literally a month, from start of a birth control pill to start of a period to having the retrieval. Those first 2 weeks, the protocol that most of us use at Fertility Specialists of Texas, we put patients onto a birth control pill for a couple of weeks. You then come off and have a period, and then you're started on those stimulation medications that Bonnie was talking about. You're on those meds for an average of 10 days of shots in the morning and at night, with visits to the office every other day, generally for between 2 and generally between 3 and 6 visits during that 2-week period, and that final visit is for the egg retrieval, and you're done on that day. That's when we freeze the eggs, and you're done.
Okay.
So why did you decide to do egg freezing in the first place?
I turned 34. And
a great age to do this.
I just decided that it was time. I'm a single mom, and I thought that I might eventually like to add to my family, and I wanted to have that opportunity, and so I decided to go through the process.
Perfect. Yeah. So one thing, one of the reasons why I feel very strongly about egg freezing is that, I went to college with a lot of friends. I have a lot of friends from college who are still single, mingling, dating, etc. And one of the things they're always complaining about is it's always on their mind that they have to worry that whenever they go on a first date with someone, that they have to worry, is this going to be the father of my children? Is this, how quickly can we get to that point? What's nice about egg freezing is it kind of releases you from that. It kind of gives you the power to take control of your fertility in a way that wasn't there before. I view it I've always talked to my patients about the fact that back in the 60s and 70s, the birth control pill kind of gave women that power over their fertility. And now I really believe that egg freezing gives you that power even more so, because you decide when you want to have kids and you don't have to worry about waiting too long.
Yeah.
What was it? Oh yeah. So Bonnie, so what was your result from your egg freezing experience?
They retrieved 31 total, and I had 16 that were mature and frozen and are still frozen.
So that's a great number. As I said before, that should give her at least hopefully one child more if she ever has to use them. And as I said before, a lot of women end up not using them, but it's kind of like buying an insurance policy in a way. Granted, nothing's a guarantee.
Yes, exactly.
Right?
That's exactly why I did it,
Yeah,
just in case.
Exactly. So you said you had no real side effects from it. Did you feel kind of that bloating towards the end of the?
Yes. I got I was a little bit bloated. I had a little bit more, just like, I felt like I was a little more tired maybe than normal. But I didn't have any reaction to, I did not hyperstim. I was taking I think the maximum amount of medications, and I personally didn't hyperstim, which was awesome.
Yeah. And how was it giving the shots to yourself, since you were a single mom, and doing this all by yourself can be overwhelming for a lot of people. At FST, all of our patients come and have a medical teaching with our nurses or our medical assistants before they start their stimulation, which hopefully helps. We also give you resources to see kind of where to take for online resources on videos about how to take injections, as well as how to use the medications. But how was it for you?
It was a little intimidating at first. I work for the fertility clinic, so I knew a lot of people who were going through the process doing IVF, married couples, and I remember thinking, oh my gosh, I'm gonna have to do this all by myself, everybody else has somebody to give them to them. The first time was a little overwhelming. I kind of stood there and stared at it a little bit, but once you get past the first one, it's not painful. I mean, as long as you follow your directions that your nurse gives to you. I didn't have any abdominal bruising from the from the shots. Yeah, I mean, I feel like as long as you just follow the directions that you're given, and it was pretty okay.
So I guess our time's almost up. So any final advice that you would give to patients who are considering doing this, or people in general?
I think that if you have access to it and it's something that you are interested in, you should definitely do it. I mean, even if for no other reason than the same reason that I did, in case I want to. If I don't, I will probably happily donate them to a couple who was in need.
Yeah. I think, this for me is all about empowerment of women. That's what egg freezing is about 100%. It's about empowering you to take control of your life, take control of your reproductive life, and not have to worry about, am I going to have to worry with infertility in the future? It's you grasping control of your fertility experience. And I think that that's an amazing aspect about this. And, if one of your New Year's resolutions is to kind of take control of your reproductive life, I think this is a great way of doing that. And come and see one of us at FST if you would like. We'd love to help you on your journey to making this happen for you. Have a good weekend, everyone. Happy Martin Luther King Day.